I am really thrilled to introduce Shahana Hanif, council member elect for Brooklyn's 39th district in the New York City Council. She was born and raised in Kensington, Brooklyn, and is the daughter of Bangladeshi Muslim immigrants. Shahana knows firsthand the problems facing our communities. She's a product of public schools, having attended PS 230 and Brooklyn College. She's an activist, community organizer, and public servant. She has extensive experience organizing to improve housing, supporting the arts, and fighting for a better criminal justice system. Most recently, she served as the Director of Organizing and Community Engagement in Councilmember Brad Lander's office, where she led grassroots initiatives like participatory budgeting, a process that gives New Yorkers a say in how to spend city dollars in their neighborhoods. When sworn in this January 2022, she will be the first Muslim woman elected to New York City Council and the first woman council member for the 39th district. Thank you so much for joining us, Council Member-elect Shahana.
Thank you. Thank you so much, Amy. And before I begin, congratulations, Wale. What a huge accomplishment. Thank you for all that you do and will continue to do in our city. Good afternoon, everyone. It does feel really weird to be called council member-elect. And thank you for the introduction. I'm Shahana Hanif, newly elected council member in the 39th district. Would love to read in the chat where folks are coming in from, which neighborhoods. If you know your council member, if I'm your council member, let me know. And I'll tell you a little bit more about my home in a bit. So welcome to the annual Health and Housing convening consortium. And the invitation extended to me to speak to everyone here. Big thanks and gratitude for all that you do and your commitment to a fairer, livable, joyful, just New York City. And I especially want this message to reach our health and human services workers, without whom it would be impossible for our neighbors to receive information about available city services and initiatives. You have always stepped up to ensure that gaps were filled consistently when the city has failed. And we have seen that especially more pronounced through COVID and as we're figuring out what recovery continues to look like. And it is in this sector that our neighbors receive compassionate care, a conversation partner. And I know this sector deserves so much better, from adequate pay to other dignified work standards. I really look forward to being an active listener as I get acquainted with the most egregious harms and work collaboratively with all of you to improve care for our care workers. So for all the human and health service workers, I really look forward to building with you all. So a little bit about me in this political administrative turnover moment. I'm among the first South Asians and first Muslim woman ever elected to the New York City Council, and the first woman to lead District 39, which includes my home, Kensington, Park Slope, Carroll Gardens, Cobble Hill, Windsor Terrace, sliver of Borough Park, Gowanus, and the Columbia waterfront. So vast district, diverse district. And I share and emphasize these firsts in identities because they reflect the kind of experience and fight I'm bringing to City Hall with years in the immigrant, tenant rights, gender, and disability justice spaces. And directly, as Amy mentioned, in the City Council at my predecessor council member, Brad Lander's office. And of course, much love to him as he becomes our city's controller. My identities signal who I'll be bringing to the legislative table and to amplify perspectives, experiences that deserve the mic. Days before the general election, I took to the streets with my South Asian colleagues in the city and state. There are only a couple of us, but Councilmember-elect Shekhar Krishnan in Jackson Heights and Assemblymember Zohran Mamdani to demand the mayor to pass a debt relief plan that would guarantee a dignified retirement for New York City's taxi workers, a workforce that is disproportionately South Asian working class. And we won that fight. So I'm really looking forward to continuing to being on the ground with our most vulnerable, harmed workers and New Yorkers to demand better. And we can win. We will always win. So how did I get here? I've been fighting establishment, politics, and organizing since 17. And of course, as a first generation Muslim kid growing up post 9/11, I was 10 when I recognized the urgency to make my neighborhood a community. But I can share the story about my politicization at 10 at another time. So at 17, I was diagnosed with lupus, a chronic illness that catalyzed my lifelong commitment to healthcare advocacy, housing, and transit justice. As a disabled teenager, I witnessed our city's nebulous healthcare system and how families with limited English proficiency like mine are forced to demand transparency in our care and treatment. While trying to understand the toll lupus would take on me and the rapid changes on my body, emotional and mental health, I had to interpret it all in Bangla to my parents and our community in Kensington. Everyone was super involved, but it was so hard to talk about this pain because I had never done that in my mother tongue, in the Bangla language. And I actually had never done that in English either. So to be able to take what was happening to me and then be able to talk about it in a community setting to deepen our care system was critical for me. And a realization that occurred very early on in my work to demand better for our city. Early on, I was rejected for paratransit, accessoride, and forced, like so many of our neighbors with disabilities, to navigate the stairs of subway stations without elevators, escalators, and paying hundreds in cab services to get around, to get to my doctor's appointments. And then at home, I shifted to the ground floor. I was in a basement room to avoid steps, but recognized that our home and so many more facilities, because it was not just at the home where I was doing everything around my life, including school and work and all of that, I was needing to get to other places. But I realized that none of it was built for me in mind, that in every space I had to demand, is there a ramp? Or will there be a hospital around me? Will there be a community clinic around? So recognizing immediately that this work needed to be very, very thoughtful and deliberate, but that is not by default how this city is built. And so this work became very important to me. And I brought that fight very locally, demanding an elevator at the 7th Avenue FG station, which is where the Methodist Presbyterian Hospital is in my district. That's the hospital corridor out here in Park Slope. And there's not an elevator that connects our neighbors to be able to get here. Over the course of the last few years, I've gotten both of my hips replaced and under the knife to be able to walk and regain mobility. And so while at this moment, I no longer require the immediate modifications that were made in my home, like grab bars in the shower. As an example, modifications, and we shouldn't even understand them as modifications. They should be the default of how we are building care in the city. They should be available to all of us at any given moment, not when we're sick, not when we're dealing with disability. And I'm here to shift that and to change that with all of you, of course, because I know you all are part of this work. So, and another part of it that really shifted the way I think about gender and gender equity in the healthcare system, I was told that there was no cure for lupus. And upon research, I learned that this disease disproportionately impacts Black and Brown women. And just that alone, I realized it was not, and it is still not, a coincidence that a disease that is overly hurting and killing Black women is not receiving adequate attention, funding, and care. And it's not just lupus. There are so many autoimmune diseases that are disproportionately impacting Black and brown women and our bodies. This is not how the system should work. And I know folks on this call and in this fight have been working to end medical racism and housing racism because they intertwine. And that we are going to continue to demand better so that no one is abandoned. So now, as a legislator, I officially get sworn in a couple of days, in the coming weeks. My orientation, because of what I've experienced, and because I've been able to navigate with other folks experiencing disabilities and young people too, because I often think, young people are left out of the conversation about wellness. My orientation is to center gender and disability justice. For far too long, gender regressive policies have impacted who is housed. And I share this because in New York City, domestic violence is the leading cause of homelessness. Domestic violence survivors in shelters are overwhelmingly women of color. And so I approach homelessness with a lens of gender justice because of my survivor advocacy in my district. We know that housing instability and precarity forces survivors to stay in abusive households. And so the orientation as housing is a gender justice issue. We need permanent affordable housing for all New Yorkers. And we can achieve this with a feminist budget. And this is transformative stuff because we don't talk about it in this lens, but we must, because we know who is filling the beds in these shelters, who we're warehousing in shelters. And so a big part of keeping women and all New Yorkers housed is to have free legal counsel. That has been a big fight, a part of the city council. I'm really excited to expand on that good work. And what I'm proposing is a survivor security fund for added measures to protect survivors even more, to provide financial support for rent, bills, and other basic recovery needs that all survivors of gender-based violence may need help paying for, that wouldn't impact other public benefits. I'm also calling for survivors to be able to terminate their lease early. New York is one of 2 states that requires survivors to be current on their rent to terminate their lease, and requires a court order to release survivors from their lease. So I really want to force the council and the way we legislate to be gender forward and not gender regressive. New York doesn't have a lock change policy for domestic violence survivors. And I'm really excited to advocate for legislation that will require landlords to change locks for survivors without having them to bear the financial burden. So this is a lot. There's a lot to do. And I can keep going. And again, just really thrilled to join you all in this conversation. I'll wrap up by saying, I'm committed, as I know you all are too, to reaffirm that this city is one that guarantees housing and healthcare, that our homes at minimum require no step entrances and will have wider doorways so we are able to age in place, that we're not forced to keep moving as we're aging, that our homes are safe for our most vulnerable women, that healthcare is language accessible, anti-racist, with mental health services as intertwined in our care. I really look forward to our partnership and the ways the consortium will engage with the new and really hopeful class of council members to transform policies. Really excited to just stay in touch. I had dropped an email and where to find me on social media, but I will type it in again. But you can get in touch with me at Shahana from BK. Happy to take questions in the chat as well. I'll be here for a few more minutes. Thank you so much.
Thank you so much, Shahana, for being with us and for so many of the important issues that you brought light on. Accessibility throughout our city is such a huge concern and doesn't get nearly enough attention. So thank you for championing that, for bringing in the intersection of domestic and intimate partner violence, which is so connected to homelessness and issues of housing rights. Just on behalf of the Health and Housing Consortium, we really are looking forward to working with you and partnering with you, helping you in any way that we can to advance a feminist budget, which is my new favorite term, and all of your work that you're championing. So we really hope to be partners in this coming year. Thank you so much for being here.